thorax. Introduction. The thorax is covered by muscles of pectoral region of upper limb. In addition, the intercostal muscles and membranes fill up the gaps between adjacent ribs and cartilages. These muscles provide integrity to the thoracic wall. A right and left pair of thoracic nerves fulfill the exact definition of the dermatome. The posterior intercostal vein, posterior intercostal artery and intercostal nerve, Vena, lie from above downwards in the costal groove of the ribs. Sympathetic part of autonomic nervous system starts from the lateral horns of thoracic 1 to thoracic 12 segments of the spinal cord. It continues up to lumbar 2 segment. Coverings of the thoracic wall. The thoracic wall is covered from outside to inside by the following structures: skin, superficial fascia, deep fascia, and extrinsic muscles. The extrinsic muscles covering the thorax are as follows. Muscles of the upper limb. 1 pectoralis major. 2 trapezius. 3 serratus anterior. 4 pectoralis minor. S latissimus dorsi. 5 levator scapulae. 7 rhomboid major. 6 rhomoid minor. 8 serratus posterior superior. 9 serratus posterior inferior. Muscles of the abdomen. 1 rectus abdominis. 2 external oblique. Muscles of the back. Erector spinae, sacrospinalis. In addition to the muscles listed above, a number of other muscles of the abdomen and of the head and neck are attached to the margins of the 2 apertures of the thorax. Dissection. Detach the serratus anterior and the pectoralis major muscles from the upper ribs. Note the external intercostal muscle in the second and third intercostal spaces. Its fibers run antero-inferiorly. Follow it forwards to the external intercostal membrane which replaces it between the costal cartilages. Cut the external intercostal membrane and muscle along the lower border of 2 spaces. Reflect them upwards to expose the internal intercostal muscle. The direction of its fibers is postero-inferior, at right angle to that of external oblique. Follow the lateralcutaneous branch of 1 intercostal nerve to its trunk deep to internal intercostal muscle. Trace the nerve and accompanying vessels round the thoracic wall. Note their collateral branches lying along the upper margin of the rib below. Trace the muscular branches of the trunk of intercostal nerve and its collateral branch. Trace the anterior cutaneous nerve as well, Fig 14.3. Identify the deepest muscle in the intercostal space, the innermost intercostal muscle, Table 14.1. This muscle is deficient in the anterior and posterior ends of the intercostal spaces, where the neurovascular bundle rests directly on the parietal pleura. Expose the internal thoracic artery 1 cm from the lateral margin of sternum by carefully removing the intercostal muscles and membranes from the upper 3 intercostal spaces. Trace the artery through the upper 6 intercostal spaces and identify its 2 terminal branches. Trace its vena comitans upwards till third costal cartilage where these join to form internal thoracic vein, which drains into the brachiocephalic vein. Follow the course and branches of both anterior and posterior intercostal arteries including the course and tributaries of asicus vein. Features. The thoracic cage forms the skeletal framework of the wall of the thorax. The gaps between the ribs are called intercostal spaces. They are filled by the intercostal muscles and contain the intercostal nerves, vessels, and lymphatics. There are 9 intercostal spaces anteriorly and 11 intercostal spaces posteriorly. Intercostal muscles. These are, 1. The external intercostal muscle. 2. The internal intercostal muscle. Each comprises intercartilaginous in front and interosseous in posterolateral part. 3. The transversus thoracis muscle which is divisible into 3 parts, namely the subcostalis, the intercostalis intimi, innermost intercostal, and the sternocostalis. The attachments of these muscles are given in Table 14.1. Extent. The external infracosphai MXSCIE extends from the tubercle of the rib posteriorly to the costochondral junction anteriorly. Between the costochondral junction and the sternum, it is replaced by the external or anterior intercostal membrane. The posterior end of the muscle is continuous with the posterior fibers of the superior costa transverse ligament, Fig 14.1. The internal intercostal muscle extends from the lateral border of the sternum to the angle of the rib. Beyond the angle it becomes continuous with the adferial or posterior intercostal membrane, which is continuous with the anterior fibers of the superior costa transverse ligament. The subcostalis is confined to the posterior part of the lower intercostal spaces only. The intercostalis intimi is confined to the middle 2/4 of all the intercostal spaces, Fig 14.2. The sternocostalis is present in relation to the anterior parts of the upper intercostal spaces. Direction of fibers: in the anterior part of the intercostal space, 1. The fibers of the external intercostal muscle run downwards, forwards, and medially in front. 2. The fibers of the internal intercostal run downwards, backwards, and laterally, i.e. at right angle to those of the external intercostal. 3. The fibers of the transversus thoracis run in the same direction as those of the internal intercostal. Nerve supply. All intercostal muscles are supplied by the intercostal nerves of the spaces in which they lie. Actions of the intercostal muscles. 1. The main action of the intercostal muscles is to prevent intercostal spaces being drawn in during inspiration and bulging outwards during expiration. 2. The external intercostals, interchondral portions of the internal intercostals, and the levator costae may elevate the ribs during inspiration. 3. The internal intercostals except for the interchondral portions and the transversus thoracis may depress the ribs or cartilages during expiration. Intercostal nerves. The intercostal nerves are the anterior primary rami of thoracic 1 to thoracic 11, Fig 14.3, spinal nerves after the dorsal primary ramus has been given off. The anterior primary ramus of the 12th thoracic nerve forms the subcostal nerve. In addition to supplying the intercostal spaces, the upper 2 intercostal nerves also supply the upper limb. The lower 5 intercostal nerves, 7th to 11th thoracic nerves also supply abdominal wall. These are, therefore, said to be thoraco-abdominal nerves. The remaining nerves, 3rd to 6th supply only the thoracic wall, they are called typical intercostal nerves. Intercostal nerve is distributed to the abdominal wall and to the skin of the buttock. Course. Intercostal nerve runs in the costal groove and ends near the sternum relatiens. 1. Each nerve passes below the neck of the rib of the same number and enters the costal groove. 2. In the costal groove, the nerve lies below the posterior intercostal vessels. The relationship of structures in the costal groove from above downwards is posterior intercostal vein, posterior intercostal artery and intercostal nerve, Vena, Fig 14.2. In the posterior part of the costal groove, the nerve lies between the pleura, with the endothoracic fascia and the internal intercostal membrane. In the greater part of the space, the nerve lies between the intercostalis intimi and the internal intercostal muscle, Fig 14.4. 3. Near the sternum the nerve crosses in front of the internal thoracic vessels and the sternocostalis muscle. It then pierces the internal intercostal muscle, the external intercostal membrane and the pectoralis major muscle to terminate as the anterior cutaneous nerve of the thorax. Branches. Muscular branches. 1. Numerous muscular branches supply the intercostal muscles, the transversus thoracis and the serratus posterior superior. 2. A collateral branch arises near the angle of the rib and runs in the lower part of the space in the same neurovascular plane. It supplies muscles of the space. 3. The main branch and the collateral branch also supply parietal pleura, periosteum of the ribs. The lower nerves in addition supply the parietal peritoneum. Branches. 1. The lateralcutaneous branch arises near the angle of the rib and accompanies the main trunk up to the lateral thoracic wall where it pierces the intercostal muscles and other muscles of the body wall along the mid-axillary line. It is distributed to the skin after dividing into anterior and posterior branches. 2. The anterior cutaneous branch emerges on the side of the sternum to supply the overlying skin after dividing into medial and lateral branches. Communicating branches. 1. Each nerve is connected to a thoracic sympathetic ganglion by a distally placed white and a proximally placed gray ramus communicans, Fig 14.3. 2. The lateral cutaneous branch of the second intercostal nerve is known as the intercostobrachial nerve. It supplies the skin of the floor of the axilla and of the upper part of the medial side of the arm. Irration of the intercostal's nerve causing severe pain, which is referred to the front of the chest or abdomen, i.e. at the peripheral termination of the nerve. This is known as root point or girdle pain. Herpes virus may cause infection of intercostal nerves. If herpes infection is in second thoracic nerve, there is referred pain via intercostobrachial nerve to the medial side of arm. Internal thoracic artery is mobilized and its distal cut end is joined to the coronary artery distal to its narrowed segment. Pus from the vertebral column tends to track around the thorax along the course of the neurovascular bundle, and may point at any of the three sites of exit of the branches of a thoracic nerve, 1 dorsal primary ramus and 2 cutaneous branches, Fig 14.5. In superior vena caval obstruction before the entry of vena azicus, the vena azicus is the main channel which transmits the blood from the upper half of the body to the inferior vena cava. In its blockage after entry of vena azicus, flow of blood is shown in flow chart 14.1 and Fig 14.6. These are 11 in number on each side, 1 in each space. 1. The first and second posterior intercostal arteries arise from the superior intercostal artery, which is a branch of costocervical trunk of the subclavian artery. 2. The third to 11th arteries arise from the descending thoracic aorta, Fig 14.8. The right-sided arteries are longer than those of the left side, as aorta is to the left of median plane. Course and relations. In front, the right posterior intercostal arteries are longer than the left, and pass behind the esophagus, the thoracic duct, the asicus vein and the sympathetic chain, Fig 14.9. The left posterior intercostal arteries pass behind the hemiazigos vein and the sympathetic chain. 3. In the back, the artery is accompanied by the intercostal vein and nerve, the relationship from above downwards being vein-artery nerve, Ven. The neurovascular bundle runs forwards in the costal groove, first between the pleura and the internal intercostal membrane and then between the internal intercostal and intercostalis intimi muscles, Fig 14.2. Term incision. Each posterior intercostal artery ends at the level of the costochondral junction by anastomosing with the upper anterior intercostal artery of the space, Fig 14.7. Branches. A dorsal branch supplies the muscles and skin of the back, and gives off a spinal branch to the spinal cord and vertebrae, Fig 14.7. A collateral branch arises near the angle of the rib, descends to the upper border of the lower rib, and ends by anastomosing with the lower anterior intercostal artery of the space. 1. Muscular arteries are given off to the intercostal muscles, the pectoral muscles and the serratus anterior. 2. A lateral cutaneous branch accompanies the nerve of the same name. 3. Mammary branches arise from the second, third, and fourth arteries and supply the mammary gland. 4. The right bronchial artery arises from the right third posterior intercostal artery. Anterior intercostal arteries. There are 9 intercostal spaces anteriorly, as only 10 ribs reach front of body. There are 2 anterior intercostal arteries in each space. In the upper 6 spaces, they arise from the internal thoracic artery. In 7th to 9th spaces, the arteries are branches of musculophrenic artery. The 2 anterior intercostal arteries end at the costochondral junction by anastomosing with the respective posterior intercostal arteries and with the collateral branches of the posterior intercostal arteries. Intercostal veins. There are 2 anterior intercostal veins iliac of the upper 9 spaces. They accompany the corresponding arteries. In the upper 3-6 spaces, the veins end in the internal thoracic vein. In 4-6 spaces, the veins end in vena comitans accompanying internal thoracic artery. In the succeeding spaces, they end in the vena comitans accompanying musculophrenic artery. There is 1 posterior infracosphoph vein and 1 collateral vein in each intercostal space. Each vein accompanies the corresponding artery and lies superior to the artery. The tributaries of these veins correspond to the branches of the arteries. They include veins from the vertebral canal, the vertebral venous plexus, and the muscles and skin of the back. Vein accompanying the collateral branch of the artery drains into the posterior intercostal vein. The mode of termination of the posterior intercostal veins is different on the right and left sides as given in Table 14.2, and shown in Fig 14.10. The asicus and hemiazigos veins are described later. Lymphatics of intercostal space. Lymphatics from the anterior part of the spaces pass to the anterior intercostal or iniphoridal mammary nodes which lie along the internal thoracic artery. Their alpharilles unite with those of the tracheobronchial and brachiocephalic nodes to form the bronchomediastinal trunk, which joins the right lymphatic front on the right side and the thoracic duct on the left side. Lymphatics from the posterior part of the space pass to the posterior intercostal nodes which lie on the heads and necks of the ribs. Their efferents in the lower four spaces unite to form a trunk which descends and opens into the cisterns chyli. The efferents from the upper spaces drain into the thoracic duct on the left side and into bronchomediastinal trunk on the right side, see Fig 20.7. Internal thoracic artery. Origin. Internal thoracic artery arises from the inferior aspect of the first part of the subclavian artery opposite the thyrocervical trunk. The origin lies 2 cm above the sternal end of the clavicle, Fig 14.11. Beginning, course and termination. Internal thoracic artery arises from lower border of first part of subclavian artery. It descends medially and downwards behind sternal end of clavicle, and first costal cartilage. Runs vertically downwards 2 cm from lateral border of sternum till 6th intercostal space. The artery terminates in the 6th intercostal space by dividing into the superior epigastric and musculophrenic arteries. The artery is accompanied by 2 venae comitants which unite at the level of the 3rd costal cartilage to form the internal thoracic for internal mammary vein. The vein runs upwards along the medial side of the artery to end in the brachiocephalic vein at the inlet of the thorax. A chain of lymph node lies along the artery. Relations. Above the ears costal cartilage it runs downwards, forwards, and medially, behind, 1. The sterna end of the clavicle. 2. The internal jugular vein. 3. The brachycephalic vein. 4. The first costal cartilage. 1. The phrenic nerve. It descends in front of the cervical pleura. Below the first costal cartilage the artery runs vertically downwards up to its termination in the 6th intercostal space. Its relations are as follows. Anteriorly, pectoralis major. Upper 6 costal cartilages, external intercostal muscles. The 6 intercostal nerves. Posteriorly, the endothoracic fascia and pleura up to the 2nd or 3rd costal cartilage. Below this level the sternocostalis muscle separates the artery from the pleura, Fig 14.12. Branches. 1. The pericardiacophrenic artery arises in the root of the neck and accompanies the phrenic nerve to reach the diaphragm. It supplies the pericardium and the pleura. 2. The mediastinal arteries are small irregular branches that supply the thymus, in front of the pericardium, and the fat in the mediastinum. 3. 2 anterior intercostals arteries are given to each of the upper 6 intercostal space. 4. The perforating branches accompany the anterior cutaneous nerves. In the female, the perforating branches in the 2nd, 3rd, and 4th spaces are large and supply the breast. 5. The superior epigastric artery runs downwards behind the 7th costal cartilage and enters the rectus sheath by passing between the sternal and costal slips of the diaphragm. 6. The musculophrenic artery runs downwards and laterally behind the 7th, 8th, and 9th costal cartilages. It gives 2 anterior intercostal branches to each of these 3 spaces. It perforates the diaphragm near the 9th costal cartilage and terminates by anastomosing with other arteries on the undersurface of the diaphragm. Note that through its various branches the internal thoracic artery supplies the anterior thoracic and abdominal walls from the clavicle to the umbilicus. Asicus vein. The asicus vein drains the thoracic wall and the upper lumbar region, Figs 14.10 and 20.5b and c. It forms an important channel connecting the superior and inferior venae cavae. The term asicus means unpaired. The vein occupies the upper part of the posterior abdominal wall and the posterior mediastinum. It also connects portal venous system and caval venous system. Formation. The asicus vein is formed by union of the lumbar asicus, right subcostal, and right ascending lumbar veins. 1. The lumbar asicus vein may be regarded as the abdominal part of the asicus vein. It lies to the right of the lumbar vertebrae. Its lower end communicates with the inferior vena cava. 2. The right subcostal vein accompanies the corresponding artery. 3. The ascending lumbar vein is formed by vertical anastomoses that connect the lumbar veins. The asicus vein is formed by union of the right subcostal and ascending lumbar veins. Course. 1. The asicus vein enters the thorax by passing through the aortic opening of the diaphragm. 2. The asicus vein then ascends up to 4th thoracic vertebra where it arches forwards over the root of the right lung and ends by joining the posterior aspect of the superior vena cava just before the latter pierces the pericardium, see Fig 15.1. Relations. Anteriorly esophagus. Posteriorly lower 8th thoracic vertebrae. Right posterior intercostal arteries to the right, 1 right lung and pleura. 2 greater splanchnic nerve. 1 thoracic duct and aorta in lower part. 2 esophagus, trachea and vagus in the upper part. Tributaries. 1 right superior intercostal vein formed by union of the 2nd, 3rd, and 4th posterior intercostal veins. 2 5th to 11th right posterior intercostal veins, Fig 14.10. 3 Hemiazigos vein at the level of lower border of 8th thoracic vertebra. 4 Accessory Hemiazigos vein at the level of upper border of 8th thoracic vertebra. 5 Right bronchial vein, near the terminal end of the asicus vein. 6 Several esophageal, mediastinal, pericardial veins. Hemiazigos vein. Hemiazigos vein is also called the inferior hemiazygos vein. It is the mirror image of the lower part of the asicus vein. The hemiazigo 5 is formed by the union of the left lumbar asicus, left ascending lumbar, and left subcostal veins. Course. Hemiazygos vein pierces the left crus of the diaphragm, ascends on the left side of the vertebra overlapped by the aorta. At the level of 8th thoracic vertebra, it turns to the right, passes behind the esophagus and the thoracic duct, and joins the asicus vein, Fig 14.10. Tributaries. 9th to 11th left posterior intercostal veins and esophageal veins. Accessory hemiazygos vein. Accessory hemiazygos vein is also called the superior hemiazygos vein. It is the mirror image of the upper part of the asicus vein. Course. Accessory hemiazygos vein begins at the medial end of the 4th or 5th intercostal space, and descends on the left side of the vertebral column. At the level of 8th thoracic vertebra it turns to the right, passes behind the aorta and the thoracic duct, and joins the asicus edu. Tributaries, 5th to 8th left posterior intercostals veins. Sometimes the left bronchial veins. Thoracic sympathetic trunk. Features. The thoracic sympathetic trunk is a ganglionated chain situated one on each side of the thoracic vertebral column. Superiorly it is continuous with the cervical part of the chain and inferiorly with the lumbar part. Theoretically the chain bears 12 ganglia corresponding to the 12 thoracic nerves. The first thoracic ganglion is commonly fused with the inferior cervical ganglion to form the cervicothoracic, or stellate ganglion. The Renati-Rig thoracic ganglia generally lie at the levels of the corresponding intervertebral discs and the intercostal nerves. Course and relations. The chain crosses the neck of the first rib, the heads of the 2nd to 10th ribs, and bodies of the 11th and 12th thoracic vertebrae. The whole chain descends in front of the posterior intercostal vessels and the intercostal nerves, and passes deep to the medial arcuate ligament to become continuous with the lumbar part of the sympathetic chain. Branches. Lateral branches for the limb 6bs and body wall. Each ganglion is connected with its corresponding spinal nerve by 2 rami, the white, preganglionic, and gray, postganglionic, rank commune icons. The white ramus is distal to the gray ramus. The gray rami commune icons along with spinal nerve supply structures in the skin and blood vessels. 01 Skeletal muscles of the whole body, Fig 14.14. Medial branches for the viscera. 1 Medial branches from the upper 5 ganglia are postganglionic and get distributed to the heart, the great vessels, the lungs, and the esophagus, through the following. Pulmonary branches to the pulmonary plex uses. Cardiac branches to the deep cardiac plex uses. Aortic branches to thoracic aortic plexus. Esophageal branches which join the esophageal plexus. Medial branches from the lower 7 ganglia are preganglionic and form 3 splanchnic nerves. The greater splanchnic nerve is formed by 5 roots from ganglia 5 to 9. It descends obliquely on the vertebral bodies, pierces the crus of the diaphragm, and ends, in the abdomen, mainly in the coeliac ganglion, and partly in the portico-renal ganglion and the suprarenal gland. The lesser splanchnic nerve ones formed by 2 roots from ganglia 10 and 11. Its course is similar to that of the greater splanchnic nerve. It pierces the crus of the diaphragm, and ends in the coeliac ganglion, Fig 14.14. The lesser-most, splanchnic nerve, renal nerve, is tiny. It arises by 1 root from ganglion 12. It pierces the corresponding crus of the diaphragm. The coeliac plexus gives offshoots called superior mesenteric and inferior mesenteric plex uses. Their branches supply the intestines and reproductive organs and ends in the renal plexus. Cardiac pain is an ischemic pain caused by incomplete obstruction of a coronary artery. Axons of pain fibers conveyed by the sensory sympathetic cardiac nerves reach thoracic 1 to thoracic 5 segments of spinal cord mostly through the dorsal root ganglia of the left side. Since these dorsal root ganglia also receive sensory impulses from the medial side of arm, forearm and upper part of front of chest, the pain gets referred to these areas as depicted in Fig 18.27. Though the pain is usually referred to the left side, it may even be referred to right arm, jaw, epigastrium, or back. 2 intercostal spaces are 11 on the back and only 9 in front of chest. 3 intercostal muscles are in 3 layers, external, internal and transversus. These correspond to the muscle layers of anterior abdominal wall. 4 neurovascular bundle lies in the upper part of the intercostal space in between internal and innermost intercostal muscles. 5 posterior intercostal artery and its collateral branch supplies 2/3 of the intercostal space. 6 right posterior intercostal arteries are longer than the left ones. 7 accessory hemiazigos and hemiazigos veins on left side drain 5-11 left intercostal spaces. Corresponding veins on right side drain into Vena asicus.